Welcome back, everybody. We're diving into something pretty important today.
Yeah.
Especially for those of you in the workers' comp world, fatigue in the workplace.
Yeah.
We've got this article here. It's from Healthy Systems, Sleep Woes, Fatigue in the Workplace. And one of the things that really jumped out at me was this statistic. 43% of U.S. workers are sleep deprived. I mean, that's almost half the workforce.
Yeah, it really is a staggering number. And, when you think about the impact that has on workplace safety and then ultimately on workers' compensation, it's definitely something we need to be paying attention to.
So were you talking about, like, that afternoon slump?
Mm-hmm.
Or is this something more serious?
Oh, no, this is way beyond just feeling a little sluggish after lunch. The article distinguishes between sleep deprivation, which is just not getting enough sleep, and occupational fatigue, which is when that tiredness is so severe that it actually prevents someone from doing their job safely and effectively.
Oh, wow. Okay, so that's a whole other level. So how do we actually measure the impact of this in workers' comp? Is it just more accidents, or is it something more?
Well, the financial burden alone is enormous, over $136 billion a year. In health-related lost productivity due to fatigue, that's somewhere between $1,200 and $3,100 for every single employee each year.
Wow, that's a big number.
It is. And, it's not just the financial cost. It's the legal issues that can get really tricky. When you're dealing with fatigue-related incidents, you have arguments about causation, pre-existing conditions, the employer's responsibility. It can get very complicated.
Right. It's not always a clear-cut case.
Definitely not. And then, of course, you have the human cost, all the health problems that are linked to fatigue, the heart disease, digestive issues, musculoskeletal disorders, mental health struggles, and all of those things, they can really prolong a worker's recovery and lead to some really costly medical interventions.
Yeah, that makes sense. And I imagine that certain industries are probably hit harder by this than others, right? Especially when you think about shift work.
Oh, absolutely. Shift work is a huge factor. It completely disrupts the body's natural sleep-wake cycle. And you're talking about millions of workers in the U.S. alone. Think about the people who are most likely to end up in the workers' comp system. Police officers, truck drivers, nurses, EMTs, construction workers, they all work shifts.
It's true. Those are the jobs we see a lot of in workers' comp. And the article mentioned that, like 92% of construction workers and 94% of transportation workers have at least 2 risk factors for fatigue.
It's a really high number.
Yeah, that's pretty alarming. Yeah. But it's not just shift work, though, right? What are some of the other things that workers' comp professionals should be looking for?
Well, long shifts are a big one. Anything over 12 hours. And then you've got extended work weeks, 55 hours or more, not getting enough breaks during those long shifts, and having really short turnaround times between shifts, like less than 12 hours.
Wow.
All of those things contribute to fatigue.
So we've established that fatigue is a widespread problem, and it has some serious consequences. But what are the actual dangers? How does fatigue actually show up in the workplace? And how does that lead to workers' comp claims?
Well, the article outlines these levels of fatigue, and I think it's a helpful way to understand how the problem progresses. The first level is decreased cognitive performance. Things like impaired memory, difficulty focusing, slower reaction times. They might seem subtle, but in a work environment, especially if you're operating machinery or dealing with high-pressure situations, they can be really dangerous.
So what about the more extreme cases? When fatigue really takes over, what happens then?
Well, one of the big concerns is microsleeps. When someone actually nods off, even for just a few seconds, and obviously that's incredibly dangerous for drivers or anyone operating heavy machinery.
Right, like a truck driver nodding off at the wheel.
Exactly. Or a construction worker operating a crane. It could be catastrophic.
There was that AAA study recently linking drowsy driving to all those fatal crashes.
It's a scary thought.
It really is.
And then, of course, the most severe consequence is an increased risk of workplace accidents overall. The article says that highly fatigued workers are 70% more likely to be involved in accidents. And those accidents are often more severe because of the delayed reaction times and the impaired judgment we were talking about.
And they even mentioned the Texas City BP explosion as an example of how fatigue can contribute to those big industrial accidents.
Right, and it's a reminder that fatigue doesn't just affect the individual worker. It puts everyone around them at risk. Coworkers, clients, the public, we all have a responsibility to address this and make workplaces safer.
Okay, before we move on, I do want to touch on something. That's a big concern for everybody in workers' comp. Prescription medications. I mean, we deal with a lot of injured workers who are often on medications that can make them drowsy or worsen existing sleep problems. So how does that factor into all of this?
Yeah, it's a big concern for sure. And the article actually lists some of the common medications that can make fatigue worse. You've got things like anticonvulsants, antihistamines, antidepressants, benzodiazepines, certain blood pressure meds, muscle relaxants, and of course, opioids.
Oh, that's a pretty long list. And those are medications that injured workers are often prescribed. So how do we balance the need for pain management and other treatments with the risk of increasing their fatigue?
It's definitely a balancing act. The article talks about the importance of communication between the doctor, the workers' comp case manager, and the injured worker. Everyone needs to be on the same page. And they need to be watching for signs of drowsiness, changes in sleep patterns, and any potential drug
Yeah,
interactions.
the article mentioned the dangers of combining benzodiazepines and opioids.
Yeah, that's a really dangerous combination. It can significantly increase the risk of respiratory depression and sedation. Ideally, it's a combination that should be avoided altogether. But if it's absolutely necessary, then it needs to be very carefully monitored.
So what can workers' comp professionals do to deal with this medication issue?
Well, first and foremost, education is key. They need to stay informed about the latest research on medication side effects and potential interactions. And they also need to advocate for a more comprehensive approach to pain management, one that doesn't just rely on medication, exploring other options like physical therapy, massage, acupuncture.
So basically thinking about fatigue is a barrier to recovery, not just a symptom of an injury.
Exactly. There's a study mentioned in the article by the Workers' Compensation Research Institute, and they found that mental health issues, including sleep problems, were actually more strongly associated with slower recovery and delayed return to work than physical health complications.
That's really interesting. So even if someone's physical injuries are healing well, their fatigue could still be holding them back.
Absolutely. And there's research to support that across a variety of injuries. The article mentions studies on stroke patients and heart transplant recipients. And in both groups, fatigue really impacted their recovery and their ability to go back to work.
Okay, so we've talked about how widespread fatigue is and how dangerous it can be and how it can complicate recovery and the implications for workers' compensation. It sounds pretty grim. Are there any solutions? What can employers actually do to manage these risks?
Well, the good news is the article outlines 5 main strategies for managing fatigue in the workplace, and they're all things that workers' comp professionals can really advocate for and support.
Okay, I'm all ears.
The first one is education, just raising awareness among employees and managers about the risks of fatigue. This could involve workshops, providing resources on sleep hygiene, or even just incorporating short safety talks about fatigue into regular workplaces.
So just getting the information out there.
Right, knowledge is power.
Okay, what's number 2?
Yeah. Number 2 is screening and treatment for sleep disorders. So this could be offering wellness screenings that include questions about sleep health, or even incorporating sleep disorder studies and treatment into health plans.
Catching it early before it becomes a bigger problem.
Exactly.
What about number 3?
Number 3 focuses on policy and schedule changes. Things like mandating regular breaks, limiting shift lengths, and making sure there's enough time between shifts for employees to get adequate rest.
Okay, those sound like pretty practical changes. So what about number 4?
Number 4 is a little more complex. It's implementing a fatigue risk management system, or FRMS. It's a data-driven approach to monitoring and mitigating fatigue-related safety risks.
So using data to understand where the problems are and then figuring out the best solutions.
Exactly. You're tracking things like injuries, near misses, other incidents that could be related to fatigue. And that data helps you identify patterns in high-risk areas so you can put the right interventions in place.
Makes sense. And what's the last strategy?
The 5th one is all about technology, fatigue monitoring and detection technologies, like wearable devices that track sleep patterns and can actually predict future fatigue based on someone's work hours. There are even technologies being built into vehicles that can monitor drivers for drowsiness in real time by tracking things like eyelid movement and blink rate.
That's pretty amazing. It feels like we really dug deep today. We went beyond just saying fatigue is bad and really got into how it impacts workers' comp and what we can actually do about it.
Yeah, I think that's one of the biggest takeaways from this article, this shift in perspective. We're moving away from this idea that fatigue is just a personal problem, like, oh, just get more sleep, and starting to recognize it as a real workplace issue.
Yeah, it's almost like fatigue is this hidden danger that's woven into so many industries.
Exactly. And because it's often invisible, it's easy to overlook, but the consequences are very real.
So for our listeners out there, the people who are dealing with workers' comp every day, what's the one thing you want them to take away from this?
I'd say this: fatigue is a serious hazard, but it's a manageable one if we understand what causes it and what the consequences are, and we know what solutions are available. We can make workplaces safer and healthier and more productive for everybody.
And not just preventing accidents and injuries, but really taking care of our workforce.
Exactly. When people are well rested and alert, everyone benefits. Morale improves, decisions are better, people are more engaged. It even has a positive impact on families and communities.
This has been a great conversation. We talked about the science of sleep, the cost of fatigue, the risks in different industries, the whole medication issue. But before we wrap up, I have one last question for you and for our listeners to think about. How do we change the culture around sleep and fatigue? How do we move beyond just talking about it and actually make real change?
That's the big question, isn't it? I think it starts with having open and honest conversations about fatigue. We need to educate ourselves and others about the risks, advocate for supportive policies and resources, and challenge those old ideas
Yeah.
that equate sleep with laziness or weakness.
It's about making it okay to prioritize sleep.
Exactly. And that takes buy-in from everyone, from individual workers taking care of their own sleep health, to employers putting fatigue management strategies in place, and even policymakers creating laws to protect workers.
Well said.